Well, a patient comes to me, and not everybody's a good candidate. So they come to me for maybe a 45-minute exam, and I use a little device called a George gauge. And that George gauge will let me see if I think they're physically going to be a good candidate for an oral appliance. The other thing we take into is weight. Weight's a determining factor. Age there are many things. If a person's overweight, they may not be a really good candidate. We may be able to help them some, but not as much as we would like. If they are elderly, we can help them some, but it's iffy how much we can help them. Neck size, for women who have a size 15 or greater, it's more difficult. A man 17-inch or greater, it's more difficult. Tonsils, size of tongue, size of mouth, palate height. I mean, there is a whole group of things that we go through and examine. Then at the end of the visit, I use a little George gauge and determine if I think this is going to be a good candidate or not. After that, then I sit the patient up and I tell them, here's why I think you would or would not be a good candidate. At that time, in my mind, as I'm going through the patient's, everything that I'm looking at, I'm starting to think, oh, well, this appliance will work, that appliance, this one, that one. Because currently there are about 250 different appliances out on the market. I use, or I should say we, Dr. Grostadere and I, use about 13 different ones depending upon what we're doing. And every single, you're going to think I'm a nutcase, every single brand of appliance that I make for a patient, before I use that brand on a patient, I've actually had made for myself and tried it myself. So in my mind, I know how these feel. And some of them may not work good for me, but oh, that'll work really good for this patient or that patient. And I think it's a form of education that you can't pay for. You can't get anywhere. But trying all of those then lets me know, or if a patient may say, oh, that doesn't look like it'd be very comfortable. And I'll say, yeah, well, when I tried it, here's what I noticed and here's what I could do, so that I can empathize with the patient and what they're going through.